WHO is calling for a moratorium on boosters until at least the end of September to enable at least 10% of the population of every country to be vaccinated.
Announced just yesterday that we hit an important milestone of over 110 million vaccines donated to the world. So we've taken action on the global level.
The United States of America and the World Health Organization, WHO, have disputed the use of COVID-19 booster shots as the world continues to battle the emergence of Delta and other new variants of coronavirus. The global health body earlier called for a delay on COVID-19 vaccine booster shots until at least the end of September to address the drastic inequity in dose distribution between the rich and poor nations. In a media briefing, the Director General of the body, Tedros Adhanom Ghebreyesus, said and explained that he is aware of the concern of all governments to protect their people from the hard-hitting Delta variant. He, however, said the WHO cannot accept countries that have already used most of the global supply of vaccines, using even more of it.
We need an urgent reversal from the majority of vaccines going to high-income countries to the majority going to low-income countries. Accordingly, WHO is calling for a moratorium on boosters until at least the end of September to enable at least 10% of the population of every country to be vaccinated. I understand the concern of all governments to protect their people from the Delta variant. But we cannot and we should not accept countries that have already used most of the global supply of vaccines, using even more of it, while the world's most vulnerable people remain unprotected.
Tedros Adhanom Ghebreyesus added that G20 nations had an important leadership role to play, as those countries were the biggest producers, the biggest consumers, and the biggest donors of COVID-19 vaccines. While responding to the World Health Organization, the United States of America said it rejected the UN Health Agency's call for a delay, saying it was a forced choice and it was possible to do both.
We believe we can do both. We also, in this country, have enough supply to ensure that every American has access to a vaccine. We will have enough supply to ensure, if the FDA decides that boosters are recommended for a portion of the population, to provide those as well. We believe we can do both, and we don't need to make that choice.
The US has had more than 35.3 million confirmed COVID-19 cases and 617,700 deaths, according to Johns Hopkins University data. At the global stage, more than 200 million cases have been confirmed and 4.25 million fatalities have been reported. Kamil Sadiq, reporting for CBA TV.